Hello, everybody. This is Dr. Naveen Nishchal. I welcome you all for today's session. Voice of Healthcare presents The Big Idea, voicing what next in healthcare. The Big Idea is Voice of Healthcare's newest virtual mini interview series that features leaders and visionaries from all walks of healthcare space in a one-to-one discussion. This breezy, snackable 10 to 15 minutes show is a quick, refreshing dip for those who want to stay updated on all newsworthy developments in healthcare. In this series, our eminent guests will empower you and with expert insight on disruptions, practices, and trends that are worth exploring and worth sharing. Our guest today is Mr. Viren Prasad Shetty, who is Executive Vice Chairman of Narayana Health and who has been instrumental in designing and building some of the key hospitals for Narayana Health, including Majumdar Shah Medical Center, as well as the multi-speciality hospitals in Jaipur and Ahmedabad. Welcome to the show, Viren.
Thanks, Naveen. Good to be here.
Yeah, thank you. So, Viren, I know you are an only engineer in the family of doctors. I also saw your LinkedIn profile yesterday and noticed how you rose from ranks to become executive vice chairman. You are not someone who leads the organization from boardroom. I'm sure there are many stories to tell, which I would love to hear from you someday when we sit together. But quickly, if you can spend a minute on your learnings and hands-on experiences during all these years at Narayana. Yeah.
Sure. It's a pretty broad question to fit into 15 minutes. I'll try my best.
So no, would be good if you can, share some key learnings that these are the 4 5 points thing that these are my learnings. So that would be really helpful for our um, audience.
Sure. See, the healthcare industry, now I come to it not as a doctor. So I'm not part of the clinical work, which makes up 60-70% of everything that we do. Everything else, finance, HR, digital, IT, maintenance, engineering, support is a very small fraction. So I look at a very tiny percentage of the total activities, but it is important. Like all parts of the body are important, all parts of an organization are important. The things that I can say are important is that, and things that I've learned, really at the end of the day, if you're working in a hospital, not as a doctor, it's like working anywhere else. You are mostly in these days on Zoom meetings all day, you are on email, you are using the same tools everywhere else. But the thing that makes it different is the purpose of your day. So at the end of the day, end of the week, end of the month, or even end of your career, when you sit back and say, what did I achieve? It is very easy to count your impact in terms of number of lives saved, number of families you've been able to provide healthcare for, number of people who were really sick, completely debilitated, and were able to get back to work and support their families, and number of children who otherwise would not have survived that you were able to save. So that is extremely tangible in a way that building a road or creating some world-class software or making a phone part, definitely every one of those is important and that makes the world go around, but you can't really count it and it's not very tangible too. So keeping that at the back of your mind always is a great thing to inspire a lot of people to come into work every day and to continuously give their best. Because what happens quite often is that people get disillusioned with work. You start to say, what does it all add up to? You're working 16 and 14-hour days in any sector. But if you have to tally it all together, you're working to the benefit of humanity, you're working to improve lives, then it becomes this thing that is a rallying call for people from all sects to want to come and work in the healthcare organization.
Yeah, I endorse your statement that uh, non-medical work also, like maintenance, engineering, all these are really very important and critical for the functioning of a hospital, and we cannot uh, so these are important part of entire hospital machinery. So Yeah, quite interesting. So, Viren, can you tell me, I mean, what is the current strength of NH now, and what are your future expansion plans?
Sure. If I have to describe our strength or our value proposition or brand positioning for the customers, there are many ways to just answer a simple question: how are you different from everyone else?
Yeah,
From day one, we were focused entirely on the average patient coming in and providing the best levels of service
yeah,
at a price that they can afford.
yeah,
Now, over the years, people have gotten more affluent. They're willing to pay more for things. The cost of a lot of the materials that we use have gone up. The quality expectations have gone up. The kind of procedures we do has increased more than 100 times than when we started out. So the changing expectations are also there. But the core proposition will always remain the same. There are a large number of people who cannot get health, they cannot get the help they need. We should provide it for them. And we should provide it for them at a price that they can afford. Now, how you can do, whereas earlier we tried many, many things on doing cost reduction in terms of using lower cost medicines, lower cost implant. We tried to do a volume thing where a lot of our doctors would increase their output, and there's only so much you can do because beyond a certain point, you can't make a person work beyond a certain number of hours a day, and you can't use cheaper and cheaper drugs because then you're harming the clinical efficacy and it's bad for the patient. So we are at that point where we have to identify other sources of inefficiency. And that has led us to realize that of the 30-40% of the work in this hospital is non-clinical, billing, discharge, supply chain, even the canteen, moving material up and down, waiting time, reporting, front office, registration, dealing with insurance. A lot of these can be streamlined. Right now, they take a large number of people to take care of, and it
yeah,
wastes a huge number of time from every person.
yeah,
See, in our industry, you have to realize that most of the things that we use, the MRIs, the CTs, the ultrasound, the medicines, are designed for a global audience. And in this case, global audience means Western audience. Very expensive. The only thing, and we're not paying any less for an MRI in India than anywhere else. The only thing we can have to reduce the cost is same machine, use it more so that each person pays less.
yeah,
But when there's a lot of waiting time, when there are a lot of inefficiencies there, when appointment and scheduling, a lot of these things are not there, then you're not able to run it to its adequate throughput. So that's what we're working on. We're working on a combination of things, automating certain functions, digitizing certain functions, or even using certain pen and paper function systems for others to improve the efficiencies across the board. So that in the time it takes from when you drive up to the hospital till the time you're able to visit a doctor, all of that should happen seamlessly, extremely conveniently, and possibly even automatically. So that when you reach a hospital, you should go directly to the doctor or directly to the procedure room, directly for your surgery. Now, we're very far away from that. The more you delve into this, you realize there are a lot of things that have to be done. And so we're working through all of that one by one.
got it. So I have one more question about technology also, which I'll come later. But before that, do you think COVID thing has changed, or any learning while you are expanding, you are putting up more hospitals? So any learning which has come with COVID?
So COVID has been this great accelerant. There are a lot of behaviors that we thought people will find more convenient. Talk to a doctor virtually than meet them physically. Less crowding. That they want to come in and get out of the hospital very fast. And so less crowding. All of those we tried to work towards, but there was never any external stimulus to bring that in. And COVID just introduced us to a completely different world where, as a hospital or as a doctor, you were completely cut off from your patients. Or to have large groups of people crowded in one place is physically dangerous for them. And so suddenly you have this need to say, okay, all the things we were talking about, all the things we want to do, there is a use case. There is a scenario in which infectious disease becomes more and more common. So you should not have waiting areas. So people should come automatically and leave. Or a lot of practices that involve going up to a physical billing counter should be done on your phone, should be done at home, should be done before, should be done after. Seeing the doctor also can be done virtually. And so COVID, all that it did was to give us a glimpse of what 10 years in the future should look like. Now, obviously, a lot of that has come back. People are still traveling, people are still coming physically to visit, but you've seen what the future looks like. So the next 10 years is about going back to that, so that in case a COVID thing happens again, it won't change the normal behavior of people transacting with hospitals.
Yeah. So I think COVID has changed, our lives both in person and in personally and professionally in a good way also. So Viren, while talking about expansion, I want to know a little bit about international expansion also. Why I'm curious about this question. I remember when I was back in 2017, I was at Harvard Business School, and I came across one study on Cayman Island. Um, NH was running a hospital at Cayman Island. So I wanted to know, I mean, how that hospital is doing, and do you have more plans to go internationally further in the future?
Yeah, the hospital is doing very well. This is the first hospital run by an Indian group in
Yeah.
the Western Hemisphere. We came as the joint venture partner for a very strong American group, but they did not see much scope in it because they are very, very big. Whereas for us, we're able to manage it in a very cost-efficient manner. And so we run the hospital ourselves right now. And it's done well. It takes care of the entire Caribbean population. It takes care of the people in the Cayman Islands. There are many other islands across the Caribbean that don't have access to really high quality care, and they end up going to the US or Latin America for treatment. And so what we're trying to do is work with the governments in those other countries to see if we can replicate the same model. And at some point in the future, we may even think about going into North America and trying the same thing, where we run a highly efficient, highly process-oriented, highly digitized healthcare system that is able to offer very high standards of care at a reasonable price. Because that is universal. It doesn't matter where you are in the world. Everyone wants the best and they want to pay the least. And so wherever you are, the model that is able to try and do both will be relevant.
Got it. Thank you. So, wherein you are working very closely on digital projects at NH, right? And I understand that technology has a huge potential. Although some of healthcare leaders, they think that technology is a cost center, but I disagree with that fact. So how are you changing the digital landscape in Narayana Health, and what all projects you are running at NH, and how that is helping in healthcare delivery?
So the number of projects we are running is too much to mention. Nearly every aspect of everything that we are doing non-clinically, we're trying to get it digitized and automated. And some things are very quick wins, like scheduling can be done immediately. We're working on that now. Some things that are more in the future, which is automatically generating bills, that may take a couple of years for us to get there, but we're working on it. But one thing to remember about the attitudes around digitization, and any company that's out there that wants to increase the scope of their digital penetration, no one doesn't want to see it happen. No one will say, no, I don't want EMR, I don't want a HIS system. No one will say, I don't want a computer. The time for that is long gone. It was in the 1990s where people had the last chance to say, I can do without a computer. Those days are gone. No one will say, I don't want. But the bigger question to ask is, what attitudes have to change? What process has to change in order for you to make full use of it? Because if you spend a lot of money on computerization and you don't change your behavior, then the computer is just a typewriter. And the same thing what you are doing on pen and paper will be the same thing that you're using the computer for. You're not using intelligence, you're not changing the way in which you behave. And so it will lead to an attitude most people have where they feel like, I'm not getting my value for money. I don't believe it is worth spending this much. And like you said, cost center.
Correct.
But it can be a revenue center. It can be this thing that can save you a lot of money, save you a lot of effort, increase the throughput, have one person do the work of 10 people, provided people are willing to change. And not just staff. I'm saying nurses, doctors, patients as well, patient relatives, all have to change their attitudes of how it has to be. So if you want to have a very efficient scheduling system, then your doctors and staff have to commit to giving slots. Your patients have to commit to calling in advance and telling you that I want this thing done at 10:30, rather than showing up at 10:15 and say, okay, now take care of me. So that takes time, it takes a lot of behavioral change, and it's something you have to work towards.
Correct. Interesting. I think technology is the future of healthcare. So, Viren, quickly, last two questions. Okay. So, with the rapidly changing dynamics of Indian healthcare ecosystem, what, according to you, should now be the focus of emerging hospital leaders?
You have to read constantly. If you're an emerging hospital leader and you're not studying business models from every sector, not just health tech, don't just look at the startups in the health tech. You have to look at startups in e-commerce, in finance, because the one thing is the pace of change that startups bring is that they allow you to see things happen in fast forward motion. There is this very famous book that's written about the disruption and the innovator's dilemma. And they studied only one industry, that's a microchip industry. Why? Because in a very short period of time, you're able to see companies build and collapse because the cycles get compressed. Whereas books written before that study the auto industry or manufacturing, where it took hundreds of years. It took hundreds of years for a company like GE to collapse. But it will take much smaller time for microchip companies to collapse. So startups give you that sense. And what it does is it introduces you to what customers want. Because no single new age company is being built today from the sense of saying, okay, this is what I can do, let me run around. They start from customer first. What does customer want? Customer wants to talk to doctor on the phone, done. Even if no doctor wants to talk on the phone, I'll figure that part out. Even if I'm losing money making people talk to the patient on the phone, I'll still do it because I'm loyal to the customer first. And so any emerging healthcare leader has to study the trends of what customers want and be able to adapt their systems to maybe not reach 100% of the way there, but at least 60-70% of what new companies are doing.
Yeah, agree. We have to, put our customer in the center of what we build. Yeah, fully agree. And with that, we wrap up this very interesting episode with Viren Shetty. I hope through this conversation, our viewers got some interesting insights into entrepreneurship in healthcare. Thank you so much, Viren, for sparing time out of your busy schedule and being with us on this show. I thank all our viewers for staying with us till the end. For knowing more on what next in healthcare, stay tuned and keep watching. Thank you. See you soon.